Hi, I'm Dr. Shah with Live by Advantia Health. Cervical cancer is very well understood now in 2023, much more so than it was in the 80s, 90s, or certainly the earlier part of the last century. Cervical cancer is well understood. Almost all cases are caused by the HPV virus. Um, the HPV virus is a very, very common virus. There are some strains of HPV that are considered lower risk, and there are a few, about 13 or so strains of HPV that are considered higher risk. And the higher risk strains of the HPV, human papillomavirus, are the ones that are associated with cervical cancer. These high risk strains of this virus really love the cervical tissue that is found in the back of women's vaginas attached to the uterus. The lower part of the uterus is called the cervix, and that's where this virus likes to attach. And it can be in the cells of our cervix for years, and eventually it can cause cervical cancer. Many women, most women who are exposed to HPV will clear the virus on their own, and most women do not get cervical cancer from this exposure. However, a small number of women will develop cervical cancer, usually later in life. It takes many, many years from exposure to development of cancer, and that's important for women to realize. Here in the United States, for the most part, as long as women are doing their cancer screenings, getting routine pap smears, and doing the recommended follow-up, we don't expect to see cervical cancer. We expect to catch the cancerous lesions we expect to catch the precancerous lesions much earlier before they become cancer, manage them, remove that abnormal tissue, treat that tissue, or follow it until it clears, and prevent cervical cancer. So before modern medicine, before we did pap smears, cervical cancer was one of the more common cancer killers of women because of the ubiquitousness of this human papillomavirus. But now that we do pap smears, it is actually very, very low on the list. I think as low as 10 or 11 on the list of cancers that women get in the United States. And that's one of the great success stories of modern medicine. So the lesson here is make sure you're coming in and getting your pap smears and following your doctor's advice regarding how frequently you should get them and the follow-up. That's the story on cervical cancer.